My name is Autumn Anderson, and for my project, I chose to do phenylketonuria. So in this presentation, I'm going to talk about the history and overview of the disorder, the signs and symptoms of the disorder. I'm going to talk about gender distribution of the disorder and molecular basis, causes of the disease, diagnosis, and treatments. Phenylketonuria was discovered in 1934 by a Norwegian biochemist and physician named Dr. Ashbourn Fowling. He found it in two severely intellectually disabled children, so what he did was he used organic chemistry, or classic organic chemistry, to test their urine and found that they excreted phenylpyruvic acid. And then later on, to confirm that this was the cause of their phenylketonuria, he tested 8 other disabled children, and they too excreted phenylpyruvic acid, or excess amounts of it, in their urine. So it was determined to be an inborn error of metabolism. And here I have a picture of the early test subjects for phenylketonuria that Dr. Ashbourn Fowling did. So we have a normal child and then a child that has an intellectual disability. And when he tested both of their urines, he found that the intellectually disabled child gave off increased levels of phenylpyruvic acid, while the normal child did not, which was the cause of his phenylketonuria. And on this side, I have Dr. Ashbourn Fowling and one of his assistants while they were conducting the early urine test. Phenylketonuria, which is more commonly known as PKU, is an inherited metabolic disorder. It causes an increase in the phenylalanine, which is an amino acid or chemical in the blood. And the disorder is characterized by severe intellectual impairment, motor problems, and skin abnormalities. The disorder is rare. It occurs in 1 in 10,000 to 1 in 15,000 newborn babies. So there are 2 forms of phenylketonuria, or PKU. You have severe and mild. Severe PKU, which is the most common, is also known as classic PKU. And at first, infants appear normal, but within a few months, if it's not caught within the first week of their birth, they will develop mental delays and developmental problems and behavioral problems. And is usually characterized by seizures, tremors, trembling, and shaking. They'll have developmental delay. Their IQs will be lower than about 50. They will be hyperactive. They'll present with autism. They have eczema. They'll have lighter skin and hair because the excess phenylalanine messes with their melatonin production. And they'll have a musty odor clinging to their breath, their skin, and their urine. In the milder form of PKU, which is also known as variant PKU or non-PKU hyperphenylalaninemia, it occurs when the infant has too much phenylalanine in the body, but not as much as severe. And it can usually be treated with following a special diet. So if you catch it early enough and put them on a special diet that's low in protein and phenylalanine foods, they won't develop the intellectual disabilities. Gender distribution, PKU affects everyone from most ethnic backgrounds. So it is more prevalent in people of Northern European and Native American ancestry, and it's rare that you'll find it in people of African American ancestry or Jewish Ashkenazi ancestry. It is you're equally at risk if you're both male or female, but females are a bit more severe with their cases just because if they are pregnant, they can give off maternal PKU, which makes the baby have a higher chance of catching it. So PKU is an autosomal recessive disorder caused by mutations in both the alleles for the gene for phenylalanine hydroxylase, which is PAH. It's found on chromosome 12, and a mutation in both the copies of the gene for PAH means that the enzyme is inactive and the concentration builds to toxic levels. So without this PAH, phenylalanine will just keep creating to mess with toxic levels in your body. The hydroxylase won't stop the production of it once your body reaches what it needs. So here I have a picture of the inheritance of PKU. So you'll have 2 carriers, your mom and dad. They themselves will not present with PKU, but they'll carry the gene for it, which means that their offspring have a 25% chance of being normal. They won't be a carrier, they won't have it. They have a 50% chance of being a carrier, they won't present it, but they'll carry the gene for it. And there's a 25% chance that their offspring will both carry it and present with it, so they'll have PKU. What is phenylketonuria? What causes it? It's a genetic condition that causes phenylalanine, which is an amino acid, to build up in the body. This is because the necessary enzyme, phenylalanine hydroxylase, is deficient. So Phenylalanine hydroxylase converts the amino acids to tyrosine, which is necessary in our body because it helps with production of hormones like norepinephrine, epinephrine, dopamine. And when those aren't produced properly, it messes with your nervous system, which is why they develop intellectual disabilities. It results in a buildup of the amino acid in the body cells and causes nervous system damage. Phenylalanine can also be found in your diet, your food. So anything that's high protein, like your eggs and meat, can also increase your phenylalanine in the body. So here I have two different dietary structures and what happens when you have PKU and when you don't. So when you don't have PKU, you'll have your regular high protein foods. Your enzymes will break them down for your nutrients. When that happens, they're broken down into phenylalanine. And when there's just enough phenylalanine, you'll have your phenylalanine hydroxylase enzyme, which will break it down and you'll metabolize it. And then you'll make tyrosine, which you then use for whatever your body uses it for. When you do have PKU, you'll get your regular high protein foods that usually wouldn't affect you, and you'll have your phenylalanine from those. And then your enzymes will break it down into nutrients, but it'll just produce more and more phenylalanine in your body because you won't have your phenylalanine hydroxylase to stop the production of it until, okay, that's enough. So you'll just keep producing and producing and producing. And when that happens, you won't produce as much tyrosine, if any, and it just messes with your whole nervous system. So phenylalanine, PKU is easily diagnosed. It's common for newborns to be routinely screened within the first 1 to 2 days of birth while they're still in the hospital. They just take a blood sample and they'll test it. And if they test negative within 6 weeks, there's usually a routine follow-up just to make sure that there is no PAH gene mutation and that there's not excess phenylalanine in the blood. So here I have a picture of the blood hill prick test, which is what happens for the early newborns to test. So what happens is they'll prick a newborn, and with that blood, they'll put it on a blood agar plate, and on the plate there'll be bacteria that only grows when there's excess phenylalanine in the blood. So healthy newborns that don't have it, they won't have a lot of phenylalanine in their blood, so no bacteria will grow on the plate. For babies that do have PKU, when they put the blood on the agar plate, that the bacteria needs phenylalanine. If they have excess in the body, the bacteria will grow and it says, okay, they have extra phenylalanine, they have PKU. So PKU can be treated with both diet and medicine. For diets, you just have to avoid high protein foods with phenylalanine in them. So these are foods like eggs, cheese, nuts, milk, chicken, beef, fish, pork, all of that. And you can also have PKU formula for those babies that do have it, which gives you all your amino acids that the baby would regularly need except for phenylalanine. So it helps with everything else and it stops the extra production of phenylalanine. And then in order for it to be effective, you have to start the dietary treatment early, very early at a young age, so that they don't develop intellectual disabilities. There's also been some medicines that are proven to help treat it. So the FDA approved Kuvan, which is also, more commonly known as sapropeptine hydrochloride, and it's used to treat PKU. It's an oral pharmaceutical formulation of BH4, which is a natural cofactor for the PAH enzyme. So what it does, it increases the body's production of the phenylalanine hydroxylase, which helps to stop the production of phenylalanine once it reaches the point within the body that it needs to stop. This is my references page, and that is me.